Hi, y'all. So, for my presentation, I'm going to be talking about insulin accessibility and affordability in the United States. So, I'm going to start with a little bit of background on insulin and diabetes itself, and then I'm going to shift to the discovery of insulin, insulin pricing in the United States, barriers to healthcare that diabetics face, and then we'll wrap it up with solutions. So, a little bit of background on diabetes. Diabetes mellitus refers to a chronic group of disorders characterized by the body's inability to sufficiently regulate blood sugar levels. Normally, the pancreas releases insulin to help break down glucose and other sugars. Diabetes can occur when the pancreas produces very little or no insulin, or when the body does not respond appropriately to insulin. There is no cure for diabetes, and diabetics often need to manage their disease to stay healthy, which usually involves a manual insulin injection. So, a little bit about the discovery of insulin. The discovery of insulin is regarded by many to be one of the most serendipitous biomedical breakthroughs in history. Prior to the discovery of insulin in the early 1920s, most medical professionals attributed diabetes to a malfunction in the digestive system that was caused by a malfunction of the pancreas. At the time, the only treatment method was to feed patients a low carb, high fat and protein diet that enabled them to live for roughly a couple months up to another year at max, excuse me. In 1921, a team of Canadian researchers successfully isolated insulin from canine test subjects and began a series of manual injections that seemed to relieve the animals of their diabetic symptoms. Following the first insulin injection on a human patient in 1922, who was 14-year-old Leonard Thompson, the researchers received a U.S. patent for their work. Interestingly enough, though, they did not seek a patent monopoly, and they sold their patent back to the University of Toronto for only $1 in a maneuver that aimed to begin rapid production of insulin for the market. By the 1930s, pharmaceutical companies around the globe had been granted licensing rights to mass produce and distribute insulin, which was now regarded as a life-saving medication for the many diabetics in the world at the time. However, as the need for insulin grew exponentially throughout the 20th century, its market value continued to increase drastically as well. So this is insulin pricing. Despite the conditions of the original insulin patent of 1923 that cheap insulin be made readily available for public use, the mean price of insulin in the United States has continued to rise drastically over the last several decades. While inflation is obviously one of the main factors in this, the augmentation of insulin prices are also a result of greater commercial interest in prescription drugs and an overall increase in healthcare spending throughout recent decades. Higher healthcare costs in the United States have been attributed to economic growth since the 1980s, coupled with vast advances in medical technology and an increasing demand for higher level services. With more cases of diabetes that are popping up across the nation, the total cost of diagnosed diabetes in 2012 was an estimated $245 billion, which was up by 21% from 2007. The price for a 1 month supply of insulin manufactured by pharmaceutical giant Eli Lilly saw a 1,200% increase from $21 in 1996 to $275 as of 2019. Many diabetic patients in the United States manually inject insulin analogs, which are altered forms of the hormone that can still perform the same function in the human body. Lispro was the first short-acting insulin analog approved in 1996, followed by aspart and glargine in 2000 and glulisine in 2004. While insulin analogs work the same way as generic human insulin, they're also the more expensive variant, with single vials of Lispro and glargine costing $138 and $120 and $125, in 2012, respectively. The insulin supply chain is also regulated heavily by stockholders, which contributes to the fluctuation in pricing and the lack of a seemingly concrete insulin market value. Regardless of price fluctuation, insulin is still outrageously expensive for the most part compared to other countries, and it is quite literally a matter of life or death for many diabetes patients across the nation. And to go off of this figure a little bit here, I got this from Business Insider. It shows insulin list prices over the years. Um, it's from 2009 to 2019. And a little bit more about analog insulin. Lab setting to create a more rapid acting or more uniformly acting form of the insulin. So they go in and they change the amino acid structure. And then in 2009, the list price for a 10 millimeter vial of Humalog, which was a fast acting insulin made by Eli Lilly, was about $93. And as of 2019, it costs closer to $275. Similarly, Novo Nordisk, which is a Danish pharmaceutical giant, their fast-acting insulin, Novolog, cost about $93 for a 10 millimeter vial in 2009 and rose to $290 as of 2019. Some barriers to healthcare for diabetics. Patients literally need to decide if they will pay for their insulin or if they will pay for their housing and food. For those who are uninsured, the matter is much more complicated and serious. A recent study used social media data to look for correlations between high insulin pricing and cost of care and patients' moods. 46,407 tweets were collected from American social media users between 2017 and 2019, and 18% of those tweets were referred to either advocacy for affordable insulin or frustration of insulin prices. Highlighting the real-world concerns of those living with diabetes and understanding the negative effects that high insulin prices can have on one's mood may help aid in policymaking and ensuring a quality standard of care for diabetes patients. However, as an aside to the rising costs, insulin underuse is becoming increasingly common across many diabetics. Modern estimates portray 1 in 4 diabetic Americans taking significantly less insulin than prescribed simply because they are too worried about paying for their fully prescribed dosage. And this can prove drastic effects on their health, could even result in death if you are not taking the appropriate amount of insulin. So to wrap things up, while the increase in the list price of insulin has increased over the years because of inflation, advances in the medical field, and increased healthcare spending, it still presents a significant healthcare financial barrier to many diabetics in terms of receiving quality, affordable care. And this financial barrier can in turn lead to insulin underuse, which can have drastic health problems in itself. And though increasing expenditures is a harsh reality, we need to find a more cost-effective, innovative ways to provide quality diabetes care in order to improve the health and well-being of diabetics in the United States. And some potential solutions for this that I have ready to talk about. Um, Newer insulin analogs are more expensive than their generic variants, so it may be financially beneficial to market a generic form of insulin. Human insulin performs the exact same way as its analog components. It's just not modified in a laboratory setting like analogs are. And generic insulin is not currently available on the market or over the counter, but if we made it available, it may help ease some financial burdens on people's minds. On the political level, many states are limiting the out-of-pocket for insulin that an insurer can charge. Colorado and Illinois are two of these states that have already passed laws that require employers to limit an employee's out-of-pocket insulin costs to no more than $100 per month. At the national level, bills have also been introduced in the Senate and the House that would incentivize drug companies to cut back on the price of their products, going back to roughly 2006 prices. And like I said, while a clear solution has yet to be enacted, insulin needs to be made more readily available and affordable to those who need it. It is quite literally a human right, and it should not be withheld based off of the patient's inability to pay.